Can everyone see that? Is that working?
Yeah, we can.
Great. So you just tell me when you need to go through.
Thank you. Is that okay for me to start now then?
Yes, Jazz, if you want to start, that's fine.
Perfect. Thank you so much. Hi everyone, I'm Jazz. I'm here from the LGBT Foundation. My role here was a 6-month contract as the QTIPOC the QTIPOC Community Engagement Coordinator. It's a very long title. And I worked other members of the LGBT Foundation, and we're going to take you through basically what we did, why we did it, and our learnings from it. So in the end, please feel free to ask, and I will slowly. Could we please have the next slide? Is it okay to get the next slide, please?
Oh yeah, I've done it. Can you not see it?
Oh, sorry, it's changed now. Don't worry. It's
There's a delay,
issue.
obviously.
It always happens. So in this first slide, I wanted to take you through what basically the problem was, the context of our project and our objectives for it. I will speak about the ways, I'll touch on the ways in which institutional race, psychological and socioeconomic barriers to healthcare, but you all are aware of that. And we'll be touching on intersectionality as well, but this piece of work is to understand why the workforce needs development and to engage the support of QTIPOC, and we'll give insight into this and our reasonings for what we did. May I please get the next slide, please? Oh, brilliant. So our first output was to get 6 sessions of 12 to 15 attendees to embed anti-racism training and to engage our workforce with the issues and barriers faced by QTIPOC. The LGBT Foundation staff, the outcome for it was that they would feel more confident and they'd feel more able to engage with and support communities of Greater Manchester, the QTIPOC communities of Greater Manchester. And we have, at this point, this is our status at the moment, had in-house anti-racism training that's been rolled out. Did a patient experience survey for QTIPOC, and I already mentioned about the staff training. So we're going to talk about a little bit more about anti-racism training for staff in the next section. So next slide, please. Thank you. So in this, I want to take you through the important factors around building anti-racism training and what you should look for when you're looking for a trainer to do anti-racism training. So to develop the training that we did here at the LGBT Foundation, we needed to know more about the needs of the audience. So we understood that the LGBT Foundation had some knowledge regarding discrimination faced by people of colour, and this training was still very beneficial to them because it added to their knowledge. So some audiences require more information than others. So it's really important to consult the staff and discover what they would like to learn about, what they would like to engage in, or if they think there's any gaps in their knowledge. Consultation is also brilliant for finding out what safer spaces means to people, to the staff, and also be part of the anti-racism training. The LGBT Foundation already has a safer spaces policy, but this was built upon for the needs of anti-racism training. So this included giving people of colour who are part of the LGBT Foundation slides ahead of the session and the opportunity to work remotely so they can step away and kind of recalm themselves if they find anything triggering in the session. Content, excuse me, content where people may feel that they're going to be triggered by it, or it's something that they're not ready to look at yet. We also did some pre-training training work, which included an outline of terminology. So it was a handout, so people were more aware of the terminology that was being used, terminology that's more acceptable now. And I think that's a really powerful tool, because language can be one of the biggest barriers of people partaking in anti-racism in their day-to-day lives. And rather than people avoid it, so this gave them that immediate empowerment to know what language to use. Some of the pre-training work also included a questionnaire before they attended the training, and I'm going to talk a little bit more about that in a minute. Other things, like simple things like having water, snacks, gluten-free and vegan options too, to ensure that people are as comfortable as they feel. Welcoming the attendees to the session in a really friendly manner shows that they're welcome and wanted there. Regular friendliness, saying hello, asking how people's days have gone as they're coming into the session, to immediately make it a really friendly, safe space. And also, what I do as a trainer is share information about the times that I've made errors in judgment regarding my knowledge about anti-racism. It really helps to bring everyone to the same level. It's just individuals who are trying their best in a world built on values that many of us don't hold true anymore. And we're just trying our best to make sure that we give their authentic selves. And individuals are really likely to have large amounts of stress going through their bodies when they're coming into anti-racism training. It's really confronting for a lot of people. Therefore, I explained at the start of the session that any fidgeting, toilet breaks or snacks won't be controlled by me, and that each person can do as they wish in the session. That also makes people feel a lot more comfortable, a lot less school-like, a lot less like they're going to get in trouble for anything. You know, they have their own autonomy. So create a safer space, but of course consultation with the people that you're training is always best. As I said, the subject of anti-racism can be really daunting and really uncomfortable for some people. As a result, we have some wraparound activities and work that are imperative to allow individuals to discuss and chat freely and comfortably, and ask questions freely and comfortably. The attendees are sent an anti-racism quiz, which is like a really reductive way of naming it, but that's what I named it. And this piece of work they must answer, it's online, it's completely anonymous, just like a little Google Forms quiz where they answer statements to yes or no. So my favorite example of this form, which many people have brought up to me in sessions, is the statement of, I can go to the hairdresser without worrying they won't have knowledge of managing my hair. Now, this is a really important one, because there's a lot of people out there who, depending on where they live, may never find anyone to manage that, like, you know, if they have afro hair, if they've a lot of hair that's very different from what hairdressers learn about, and you have to go find a specialist. And when people realize that there's this one tiny thing of care that a lot of people do every few weeks is so difficult for people, kind of brings the barriers like really into the mind and into the day-to-day life. And I also, to ensure people start to feel comfortable with being uncomfortable, an article called 5 Steps to Accepting Your Privilege is also takes individuals through what they're feeling, the reasons they might be feeling it, and the fact that they don't need to feel guilt or anger upon learning this knowledge about their privilege. No one was chosen to be born in a certain body or environment, but it's up to us to do our best to empower other people when we do have that platform. This really helps people to sit with the discomfort and continue to learn how to feel uncomfortable, and how to take that uncomfortable feeling, turn it into learning. And when people have something that they know they can do, they're definitely going to go ahead and do it. During the initial training, images were used from different spaces of England that occupied European colonization, and we used images a lot because we wanted to make sure that the input of knowledge was quick, and also could meet all of the not boundaries, but all of the needs of people with neurodiversity. So we also made sure that it was available for people who are colourblind. Colours were good for people. And so we first showed this map from European colonisation and where queerness had been outlawed, and then we showed a map now where those countries are within their ideas about racism and LGBTQ ideals. And a lot of them, although they are full of people of colour, unfortunately those people of colour are infighting because of the ways that because of and people of colour. So it means that we're getting that idea of intersectionality in there, and then we can develop that further. Once training is completed, the individuals receive a PDF called Becoming Racially Literate, and this includes podcasts, videos, books, and films. So it's not all like doom and gloom. Some of them are really good films by really great directors. It's just getting immersed in the culture. And then there's also some bits and bobs for children on there, YouTube videos, podcasts, everything that you could possibly need to carry on your learning. And if this learning is encouraged by workplaces through policy and procedure, then it will continue to happen, which is absolutely great. And I know you're desperate to get your hands on that reading list, so that will be sent to you with the feedback form after this session. Could we have the next slide, please? Thank you. 2. This was to do 12 engagement sessions spanning a number of needs for the community, structured in a way to eliminate barriers for healthcare for QTIPOC. Because of the historic distrust of the healthcare professionals, there are many barriers for QTIPOC before even entering a healthcare space. So the first thing that we needed to do before we asked them for their experiences to get more knowledge about where they feel barriers are in healthcare, we had to build. So I used my personal networks, QTIPOC focused networks, and worked with the communications team at the LGBT Foundation to build excitement about the project and reach out to the QTIPOC community to let them know that this project was happening. I also reached out to healthcare leaders within the community. So this will be people who are wanting to be activists for healthcare for QTIPOC and are doing a really good job at it. And they help facilitate some of these sessions. So those people are very well known in the community, so and help bring the trust in, and also letting them know very transparently what was happening, what would happen with the knowledge that they gave us. Each session followed a structure due to the damaging nature of like potentially re-traumatizing people by asking them for their experiences of healthcare. Each session followed a structure. So sessions were culturally themed, centered on ancient wellbeing practices such as yoga and Tai Chi. And we also had informative sessions about the NHS, how to get and the LGBT Foundation services. We ended each session with something like mindfulness or breathing techniques to help regulate the nervous system and better reduce the psychological barriers that may stop people advocating for their health. In these sessions, I wanted to bridge the gap for these individuals so they would want to return and assist in feedback. I spoke to each person individually, explaining the needs for the QTIPOC experience survey and its importance in changing services. The engagement sessions drastically increased patient experience from queer, trans, intersex people of colour. The survey averaged about 17.75 submissions per week, whereas a similar survey that was for all LGBT people that was run biannually by the Pride in Practice department here had only on average 4 per week from QTIPOC. So they had a lot of responses, but only on average 4 per week from QTIPOC. The percentage increase of 79% per week shows that building trust in the community, the community engagement is working. So we're just going to talk a little bit about the experience survey in the next slide. Okay, great. So from oh no, what have I done? I was on my wrong notes, sorry about that. Evidence. So we're going to talk now about the QTIPOC patient experience survey. So there's a lot of psychological barriers when healthcare. And one of the things that we found from the patient experience survey was that 35% of respondents said that anonymity was the most important factor for them, but with 14% citing it as the only important factor. And the reasons for this are because many individuals with QTIPOC live in multi-generational tight-knit families, and communities often grow up in the same area. Therefore, friends, families can become healthcare professionals. Like, for example, my dentist was my dad's best friend's wife. So if my HIV status changed, or if I needed to talk to the dentist about anything, I would not feel comfortable, because even though there is confidentiality there, it's very close to the family. Sorry, is it possible for everyone to mute themselves? Thank you. Sorry, I was carry on. This is a so that is obviously a very emotional response. Like, logically, that would not be a problem, but unfortunately, that's not something that we can't stop people from having their emotions and having that distrust. Sophie, is it possible to mute everyone?
Yes, that's what I'm just trying to do now, but I can't see the screen because I'm sharing the slide, so sorry, just bear with me.
Oh no.
Whilst there's a gap,
sharing
could I just, sorry, could I just highlight, because I think it's no one's checking the chat. A couple of people are having issues with their, sorry, I'm getting distracted now.
It's changed now.
Oh. Okay, I've just muted that person. Some people are having issues with the consistency of the sound. So I just wanted to highlight that whilst there was a break.
Oh yeah, of course.
Colleagues, so I was just going to offer, while you're sharing slides, Sophie, I'll keep an eye on people muting if you want to carry on staying on the slides. I was going to suggest, Jazz, if you want to turn your camera off while the slides are being presented anyway, it might just help improve sound for people. They're struggling to hear you. It keeps cutting out periodically.
Thank you so much. Is that better?
We'll see how we go. Thanks.
Yeah. Right.
Thank you. Sorry about that, everyone. So as we can see, a lot of the respondents were looking for anonymity. 34% were interested in the reputation of the healthcare service, so what can be found on the NHS website, their reputation for working with LGBT parents and patients, and also specific LGBT training. This was followed by 31% of respondents who based their decisions on from QTIPOC that they considered safe. So although there are many people who would want to stay anonymous from maybe other people in their lives, there are also a lot of people who would actually really enjoy and like having recommendations from other QTIPOC so that they know that they will be treated a certain way and given the healthcare that they need. Is everyone okay with hearing now?
It's still a bit intermittent.
Yeah, you're still cutting out a little bit for me, I'm afraid.
Someone in the chat has suggested that we turn our cameras off to see if that helps.
How's that sounding now?
Go for it, Jazz. Thank you.
Thanks very much. Sorry about that. So as I was saying, 31% of respondents based their decisions on recommendations from other QTIPOC, people that they feel safe being around. In Greater Manchester, the QTIPOC community is quite I don't want to say quite small, there's a lot of us, but we do have networks where we do give each other this information. So it is a very good thing if you have a good reputation, and then those people are also sharing it with other people that they know. So that's good. And that's what we got from the survey. So if we move to the next slide, please. Okay, so everyone should be able to see output 3, the top of their slide. So just pop in the chat if you can't see that, and we'll see what we can do about that. But I think that should be fine for everyone. So output 3 was from our people plan, and this was to develop and embed more anti-racist approaches and methods as a result of engaging with QTIPOC communities in Greater Manchester. The outcome was that this would lead to workforce and organisation as a whole adopting the anti-racist methods and approaches, with a knock-on effect to our service users, leading to further reducing health inequalities. We're actually going to share with our people plan with you, so you're going to have a more in-depth knowledge about what we've been doing. For 2023, the LGBT Foundation will be taking on a 5-year project plan to improve the experiences of our people. Equality, diversity, and inclusion is considered to be a golden thread of this plan, and will be a driver for the reasonings of projects and approaches that we take. Our project plan is expansive and covers a broad range of areas across whole operations, development, process, and policy. It is therefore important that our work in these areas is implemented with equality, diversity, and inclusion. This will help us modernise, update, and prioritise EDI as a core value of the work we do for our people. Any learnings taken from this project in regards to EDI has been shared with team people and will be implemented into the people plan. So anything QTIPOC specific. Here is a bit of information about output 3 and what we've got so far. As I said, you will be getting a longer document which has more insight. Oh, sorry, could you go to the next slide, please? So this little loading picture is just because you will be sent the longer document shortly. But I wanted to give a quick overview of the main points of the plan. So we have performance management, and this means treating employees as individuals as opposed to their intrinsic value as opposed to their numbers. Personal development plan, which includes focus group work that our people need, and external and we also have personal development plan, which includes focus group work to find out what our people need, and also external and community consultation. Managers training, which includes scheduled line management training, such as unconscious bias and represent. Oh no, that's wrong. Such as unconscious bias training and anti-racism training. Employee engagement, which includes prioritizing intersectionality when working with staff networks, empowering people to make good choices, and community trust building. Onboarding, people will be required to do anti-racism training, anti-misogyny, trans awareness, disabled and neurodivergent training, which will be embedded into inductions. There will be a policy review cycle, which will be equity affirming policies for developmental staff equity affirming policies and staff network and union consultation. Lost my words there. If you could please go to the next slide. Thank you so much. So this is output 4, which is what we're doing now. So this was for us to have a seminar held at the end of the project to speak with NHS staff about the results of this project. It's an opportunity for you to ask questions, for us to share our learning. And as I said, we would love any feedback from this as it goes into our evaluation. be sent that after this session. So please do take time to look at the additional information and think about how you felt about what we spoke about, and do please complete the survey. Apologies for the technical issues that we had at the beginning and in the middle there. But I think that's all the information that you should need. So please feel free to start asking any questions. I also know I tend to talk a bit fast. I was trying to talk a bit slower. So if there's anything that I missed
Thanks,
or anything
Jazz.
that you didn't understand, please do let me know. I also welcome compliments. Just nobody had any questions. So.
Oh. Sophia has one. Sophia has one.
Yeah, I do. Thanks for that. And yeah, it was really, really great, Jazz. Thanks for that. It's really helpful. I've just got one quick question regarding the kind of the program of delivery of change that you're introducing or you're hoping to introduce.
Oh,
and you mentioned that it was going out to new staff or volunteers as part of the induction. What's happening with regards to existing staff, because obviously they make up a bigger area of workforce, and if they're not being trained or educated on issues, and that change that we need might not happen. Does that make sense to you?
So all of our current staff have so it just be condensing it so that it happens for people during their induction. We normally do anti-racism training once every 6 months, and new starters will go and do that, but it just makes sense to do it like sort of all in one go, so people know that yes, I've got that array of knowledge, I now need to start my job.
Yeah,
does that help?
Yeah, it does in part. It does in part. It's the existing staff that I was kind of concerned about. Is the training for them being monitored, and do they have sort of
yeah, so the training
reviewed
for
at appraisals and things?
Current staff has been run. Sorry?
Oh dear.
Sorry, I didn't hear that last bit.
Sorry, it was up to me, Jazz. It was just about is the training or the outcomes of that training and monitored in any way for existing staff?
So yeah, existing staff have had the training that the future staff will be inducted for. So they've already had that training.
Okay, great. Thanks for that. Thank you.
No problem. Sorry about the sound quality there.
Shall I jump in there? I don't know. I think I've got my next hand up.
Yeah.
So thanks. I'm Sue Howard. I'm head of the Workforce Collaborative Programme Development. So just to give a bit of context, I oversee the portfolio which funded some of this work. I guess I'm just thinking about, because I'm conscious, and thank you for presenting today. We've caught up recently, haven't we, Jazz? So I've heard a bit more of the detail there as well. It's some brilliant work that's going on, and definitely see the value of this in terms of its spread.
Sorry, could everybody mute themselves and just turn their cameras off, because I think it's causing some issues.
I think we've lost Sue, haven't we, Jazz?
Potentially, yeah. She's frozen though.
Yeah. Sue, I don't know if you can hear us.
I can hear you. Don't know if you can hear me.
Oh,
we'll just blame the balmy weather making it all go a bit crazy today.
Am I back now? Can you hear me okay?
Yes, yeah.
Great. So yeah, just thinking about how we spread this learning. Obviously, the pilot work has been developed in-house at the LGBT Foundation, but I'm really keen that we make sure that we maximise this and we spread that learning. And going back to Sophia that had just mentioned about there's obviously a huge number of people working across health and social care that would really benefit from some of this stuff. And it's about how we disseminate that, I suppose. So we can help spread some of that learning. But I suppose my question to you, Jazz, was, have you considered about what kind of information you would be looking to share and disseminate with that established health and care workforce? So obviously they're really busy. They can get really overwhelmed with a lot of information. Have you thought about what level of information, what kind of information we might want to share across our networks to improve understanding in this space?
I think it depends very much on the individual space that we would want to help engage more people from those communities that we were looking at. Because as you said, a lot of people are really busy, so you kind of need to work to what they are able to do. So it might be that we send an information pack and they take their time going through it and learning, and then after that book in a session with our Pride and Practice team, who can give them more information about how to be more forthcoming with these communities. I think that is a really good question, and it's a really difficult one, because this sort of the embedding anti-racism learning and anything that goes against what we've been taught societally, it's a lifelong journey. So it is trying to get people excited about these possibilities, so that they want to do it even more. So that is a question, that's a big question that I think definitely needs some thinking about. But I think there's definitely an information pack at the very least that can be put together to give people the empowerment and the drive to make space and time within their environment.
Is it worth me just jumping on?
Oh yeah, Alex is also here today.
Hi, I'm just jumping in. I'm sat next to Jazz. I'm Alex Matheson. I'm our Deputy Director of Inclusion. And just to add that, as you're aware, this is an initial pilot project that we've been sort of starting the process, really. And the idea around being able to take that learning and further engage with the wider healthcare workforce, especially in GM, forms part of next piece of work, within which we have got an outcome that will allow us to create specific in-house recruitment training and work with internal HR to embed modules, so that it'll allow the sharing of that learning to be rolled out more effectively.
I think we've got another question. Is that it, Sue, or do you have another one?
I'll re-raise my hand, I suppose, just to think about that a bit further, and maybe that's something we engage with you with to see if there are other opportunities to try and embed some of this learning. There may be other ways of doing this, feeding into things like inductions. If there's a generic induction being created, you know, at a system level, or could be disseminated, it could be a pack that goes we could disseminate through our networks. There may be a way of doing that. There may be a way of better doing it to the established workforce. The numbers are huge. So to do that through sessions would be probably quite challenging, because this is something we all should be doing, right? We all need to be aware of this. So how do we disseminate that information to make sure it becomes embedded and part of what we do? And there may be a more efficient way of doing that. So maybe that's something we can maybe touch upon at some point and have a think about how we might support that a bit more.
Yeah, that would be great.
Tolu, do you want to come in?
Hi everybody, can you hear me? Can you give me a thumbs up if you can?
Yes.
Perfect. I'm remote to Alex and Jazz today. Just want to congratulate my colleague on a great presentation done, and Alex as well for overseeing some of this work.
Thank you.
Yeah, no problem. So I'm just fresh on UK soil, so I've been overseeing this from afar. and letting Jazz run with it. But I can answer some of these questions from a standpoint of sustainability and longevity and embedding these processes into the workforce. I was involved from the very start before Jazz got here to take over. I've heard a few problem words here, just not to raise any red flags, but when we start talking about generic, when we start talking about widespread and broad strokes applications of anti-racism, I think that's where we get into issues. So a lot of the work, the pre-work that we did around anti-racism training and in terms of inclusive recruitment workshops as well, a lot of that learning has become very directorate specific, and it becomes very difficult to embed effective and actionable and practical applications of this work when we start sticking broad strokes plasters over huge workforces. And I think that's the issue that we need to try and work with you on, how to disseminate some of this information across really huge workforces. Now, we're a workforce of around 100 at the moment, and I think we trained around 150 stakeholders, and even that was quite a large demographic of people. Anti-racism is a very individual and a very subjective and a very emotional and I guess individual journey. So you're trying to get this whole workforce to logically work on processes and policies across a whole workforce that actually affects everybody individually. So a lot of the work that we did was around people's own journey of identifying their own race, their own emotions and their own work within this space, in order to then figure out how to work within your team, how to work within your directorate, and then how that works cross-organizationally. So I think the most important thing that we can share with you is the pre-work. We did a lot of demographically targeted focus groups in the first instance, and we really broke down who it is that's doing the work, what directorate you're in, and how you can feed this into work that's already going. It's very difficult to, I guess, use anti-racism and inclusive recruitment as an addendum, as an add-on. It's got to be something that's really integrated into your process. So how do you weave this into meetings that already exist, into conversations that might already be happening, or carve out time within meetings and programs that already exist? Like, what does it look like to really feed this work in internally, rather than kind of stick it on to the end, to use the scientific and very technical terms. But yeah, it's trying to figure out how to do this thing that is very individual and figure it out across a whole workforce. That's the stuff that I'm really interested in, that we're really interested in trying to share. What does it look like to do that work beforehand, rather than trying to do this in a broad strokes across a whole workforce? So yeah, I'd love to talk and keep talking about that conversationally, but it's been really effective. You can see that in our demographics and how our workforce feels a little bit more supported. We're not just talking about numbers here, we're talking about retention. How many of those people and colleagues of colour are the same colleagues of colour when you're talking about percentages that increase? What's the turnover of your workforce? And that's the auditing that we can share with you as well, and what that looks like. So I hope that helps a little bit.
Oh, thanks, Tulu. Could
No
we bring
worries.
David in? He's got his hand up.
Hi there. Sorry, I don't have a camera on today as I've just moved house and I dread to get into my PC to start sorting out my webcam. But I just wanted to add as well, firstly, thanking Jazz for all their hard work on this. It's been very interesting as a project working in a similar area, to see the development of it and have time together to share learning from each of our projects as well. I just wanted to echo what Tolly was just saying there in terms of the way that projects working on inequalities, how sustainability looks for them, because we're finding a very similar thing, that I think there's a kind of a push towards sustainability, meaning something that's quite broad strokes, whereas actually we're finding that the work we're doing, which is specifically around inequalities in cancer care, needs to be quite targeted and quite specific, and often it's interventions in kind of key areas where there's issues that have been identified that could potentially be a more a better model to look at, so to speak. And I just wanted to say that if this work is continuing, which I very much hope it does. I think there's a real importance that the other work going on in inequalities, we try and collaborate and share as much together as possible, because already finding that there are elements where the expertise that this project has been really useful for us, and hopefully, Jazz, that you potentially found the same as well. So making sure that we've got that collaborative outlook and the ability to share and signpost to all the different work that's going on.
Oh, I did. Thank you, David. To have connected with you the last time we were on the same call and have those chats about how we can support one another. Oh, I think there's another question.
Yeah, and Andrea, is it?
Hi, hello. Let me know if you can hear me okay.
Yeah, perfect.
Yeah, okay. Just wanted to pick up a bit on what Tulu and David were just saying, and specifically, one of the main concerns about getting involved in any type of healthcare for not just queer, trans, intersex people of color, but say trans people in intersex people in general, one of the first barriers precisely is their GPs. So is there any focus or maybe a conversation to be had regarding where this campaign is going through or going towards, is and again, bringing up what Tolu and David were saying, what are the conversations, or what's the plan on trying to integrate this into primary care? Because I find that it's from the feedback that I get, it's quite hard for to get any type of support, especially the more remote you are. So, not necessarily Manchester, London, Liverpool, outside of those areas. If there's any push into really integrate this into being, that depends on the individual trust or surgery. But I believe there would be some usefulness on the LGBT Foundation trying to push, not insist, but trying to at least promote that this should be some sort of mandatory, so that those trusts and those surgeries can make it as a mandatory training, rather than, because this is kind of how it feels, is that it's very it's taken in a very blasé kind of way. It's not being taken very seriously. It's always something optional to do, and it's not integrated as part of core training for any healthcare services, and it should be part of that core training, and it should be definitely integrated more into specifically GPs, because that would be the first point of contact for a lot of trans people and a lot of people trying to come out, and a lot of intersex people trying to deal with the issues. Is, can they trust the GP to actually help them? And being people of color, can they, can those GPs keep that confidentiality and not spread it through their through the families of the patient and so on? So is there any integration of that into this campaign of thinking, how do we get these surgeries to, I think you get my point.
Yeah, thank you. It's Alex again, just picking up on that one. So there's a couple of points that you raised there really regarding primary care. And just to address, like, first of all, around core training and that mandatory training. It's definitely something that as an organisation we try to influence, because that's kind of as much scope as we have as organisation. We're trying to influence the medical training criteria and the curriculum for that as much as is possible. This has been a long road of trying to influence that, but that doesn't mean that we'll stop. But we certainly recognise that there's difficulties, and especially when we're talking about doctor level training, you know, even the case studies that are produced as part of that, even in an area as diverse as Manchester, are wholly unrepresentative of our communities and the within the area. So it's definitely an issue, which then means that this is something that needs picking up outside of the main training curriculum for healthcare professionals, especially doctors and GPs. So ourselves, we have the Pride in Practice scheme that's been running for a decade now in Manchester and in other areas, but it's particularly well embedded and has been particularly well supported in Manchester. And part of that training is, you know, around improving the competence of our practice staff. So not just the GPs, but also like the admin staff, the receptionists, anyone that a patient may come into contact with, whether knowingly, as in face-to-face or on the phone, or not, because they're handling their records in the background. And our training within that process is constantly updated and adapted. And you know, this is one of the reasons why this project started with our workforce, because our workforce, you know, is health and social care workforce development directly. So all of the learning that we're getting from this project and everything that we're discovering and the processes that we're finding as beneficial will be embedded into our Pride in Practice, and also looking further than that, our Rainbow Badge, which is for secondary care training offers and assessment process. So the aim is that this will directly trickle out to those practitioners and to the practice staff in a kind of like and normal way through the regular updating of that process. So it will take a little while, but it will feel more embedded. And I guess that's the thing that we really want, is to have this work embedded and almost business as usual, that, you know, all the work that we undertake with healthcare staff has anti-racism at its core. And I guess that's the ultimate aim, to kind of bring up the points around both your like core and specifically primary care. So hopefully that answers your question.
Yes, thank you.
We have a question from Joanne Davies.
Hello, I'm from Manchester Foundation Trust, so obviously in terms of our staff, we've got 28,000 staff. Okay, so I was just going to ask Alex, is there any way that you can share the resources for your Pride in Practice training? We've been tasked with including various different types of training to tackle inequalities on induction programs, but trying to get resources that are suitable, you know, obviously takes time. So anything that you can support with would be really appreciated.
I'm really sorry, I missed the first part of your question. I got that you're from Manchester Foundation Trust, and then the next bit was any kind of resources would be appreciated. Was the specific ask?
Yeah, you were talking about the Pride in Practice
that I missed.
Yeah, sorry, can you hear me okay? Because it does keep cutting out the sound.
Yeah, it's in and out.
Yeah, okay, I'll try and repeat it and hopefully you'll get it this time. I was saying that we've got 28,000 staff. And one of the things we're trying to do is a whole raft of training around tackling inequalities. And you mentioned the Pride in Practice training that I am aware of has been running for a long time. Can you share any of those resources to support us with developing a training portfolio?
Those resources are specific to primary care. And sorry, I thought you'd stopped. It must have been the sound cut out. But so the Pride and Practice resources are unique to primary care. They're designed around primary care, and they are funded for delivery to GP practices specifically. We have done some work with Manchester Foundation Trust on a pilot basis, specific services. And I know that we're going to be doing some additional work around supporting the trust in other areas, so it will probably kind of disseminate out in the same way.
Yeah, I've been on your champions training. Well, I've been on a few modules of it, still to finish it, because I've been asked to write training to pilot, starting to get that training out to our community staff, community diagnostic staff. So yeah, and I know that the trust have done some training, but it's just, we're just lacking in resources, and anything would help. But if you haven't got anything that you can share with us, that's okay too.
Yeah, I mean, there will be some stuff that's coming out following this that you might find useful to sort of draw on. But I'm conscious that like a lot of the stuff is specific to the, like I say, this is the purpose of how we do our training. It's specific to those environments.
Okay.
Particular need, but the more general stuff, I know that Jas is sending us a follow-on from today's seminar, so that might be helpful.
Fabulous, that's great, thank you.
It doesn't look like there are any more questions now, Jazz, I think, unless anyone has anything else they want to add. No. The session is recorded, and I will be sending the YouTube link around that you can share with colleagues who were unable to make it. I'll also send Jazz's presentation around with a couple of PDFs as well. So that'll follow up either tomorrow or Thursday. But if there isn't any other questions, I think we'd just like to say thanks for joining us and taking the time to listen.
Thank you
Get a
very
few.
much. Oh, and also, I just wanted to say if there were any bits or you weren't too sure, drop me an email. It's just jas@lgbt.foundation. And I'll clarify anything for you that maybe got cut out or was a little bit like the sound got in the way or anything.
Do you want to just quickly stick your email address in the chat, Jazz, and then because you cut out again at the beginning.
Yeah, I'll do that now.
Great. And if you have any other further questions, you can just send them to me when I've sent you an email as well, and I can pass them on to Jazz if you don't get to see her email in the chat. So thanks again. You've got 5 minutes of freedom now, so you can go and have a cup of tea or a coffee or whatever you fancy. And thank you again for joining us and putting up with the sound problems. Again, I'm going to blame the balmy weather. So thank you very much. Have a lovely day. Thanks, Jazz.
Thank you all. Thank you. Bye.
Thank you. Bye.